When we've got really long waits, given the pressures at the moment, that's happening on sadly a fairly frequent basis. Patients can often feel like nothing is happening, even though we're, say, waiting for blood results or waiting for a ward bed and they've had their antibiotics and they're not due their next ones for 8 hours. People can feel abandoned and like nothing is happening. And just coming round, showing your face and saying, this is what you're waiting for. I'm sorry you're still in A&E, but you're still getting the right treatment. Can we do anything to make you more comfortable? People really respond to that. And even though it may be a senior nurse and a senior consultant going to make that cup of tea, that actually buys a huge amount of goodwill.
One thing that most people want is the thing that we all want, which is just basic. It's just a cup of tea, a hello, and just somebody to recognise that you're here and that you know what you're waiting for and that you've appreciated really, and a cup of tea just has all of those things.
You know, you will get perhaps relatives and even patients sometimes, you know, they get irritable. They've been here a long while and they might get a bit stressed, you know, so, you know, you can go in and say to them, oh, you know, would you like a cup of tea, a few biscuits or a sandwich, and sometimes it takes their minds off of things, so they say, oh, well, a cup of tea or a cup of chocolate, and totally different.
I do a number of little odd jobs here, run errands and things, but probably the main thing I do is to make the tea and coffee. So I go around with my tea trolley and ask the patients and also their relatives and friends that they've come with if they'd like tea or coffee. So that's my little job.
Looking after families, you have to bring them involved because it's not just the patients what are going through a hard time, it's the families as well. And we like to bring them both in to make them both feel comfortable and let them know what's going on. And a cup of tea, you know, can build up a relationship between healthcare assistants and the families.
We all like a cup of tea or cup of coffee, and we also do them in nice cups and coffees and bright colours. Just makes them smile and just makes them feel a little bit more at ease with coming into a place. And of course, a lot of people, especially our older patients, like nice cup of tea with a saucer, which we've got them as well. And we've got the bone china ones for them. And they love that, with a biscuit on the side. It just makes all the difference.
Yeah, even before they've had the baby, you're going, think of the tea, and it's often received as the best cup of tea they've ever had in their life.
For patients with cognitive impairment, that's memory problems, things like dementia, it can be very difficult for patients with these issues to recognise unfamiliar objects, and a plastic white cup in a blue plastic holder does not resemble any form of cup of tea that these people will have used 20 or 30 years ago, which are the memories that they're basing their decisions around now. So by introducing a cup and saucer, it now becomes a familiar object and it can encourage people with memory problems to drink.
It makes all the difference that you don't have to be trained in anything to make someone a cup of tea. It's the ultimate sort of care thing, isn't it? We love a cup of tea in Britain. Something's going wrong, you don't know what to do, you say, I'll put the kettle on.
But I know it's that people appreciate having a tea or coffee while they're waiting. Some of them have to wait for blood test results and things, so it's important that they have a bit of comfort while they're waiting, or they're a bit anxious about the treatment that they're going to have. So we try and cheer them up with a cuppa.
It's often said that the hot water that we need for birth is actually to make tea. It's not for any other purpose. We need the towels to dry the baby, but we need the hot water to make the tea with.
It shows that you are humanitarian and that you care about their well-being, and it shows that you're willing to take time to look after those less scientific needs, but still much needed and often unmet needs when the department is really busy.
I think it just symbolises just a general offering somebody a cup of tea that you care. You know, they're not just in hospital. We're helping them, we're helping the patients, but we're helping the families as well. Just a cup of tea goes far, you know.
That's part of their care. That's as important as giving somebody a tablet or giving somebody a drip. It's part of showing that you care, and that's what we're here for.
Well, a cup of tea always makes things better, like, you know, it makes the world go round.
The value of a cup of tea, it's priceless, isn't it, the value of a cup of tea?
As a tea drinker myself, I think there's nothing like a cup of tea to put you into a relaxed mood, so I think it's very important.